Hi everyone! Let's talk about breastfeeding today. This is a topic that's very near and dear to my heart, and I know for a fact that there is confusion and misunderstanding surrounding this topic in terms of how breastfeeding potentially contributes to the formation of cavities in baby teeth. So what's the deal? Let's break it down to the facts and get the story straight. So my goal for these videos is to provide education and information that is relevant to our community and as it pertains to children's oral and dental health topics. So for those of you who don't know me, I am Dr. Bana Ball. I'm a board-certified pediatric dentist and the founder of Shady Pediatric Dentistry in Rockville. We have a brand new office here on Shady Grove Road. We just opened a little over 2 months ago. And I want to talk about breastfeeding because, as I said, this is a topic I care about very, very much. And I just want to set the record straight for everyone out there who is still unclear on, can it contribute to the formation of cavities or can't it? So what's the truth? And let's get the facts straight. Oh, can I ask you a favor actually? Can you let me know by typing in the comments where you're watching from and if you are a nursing mom or if you're somebody who works with nursing moms. Just curious to see who's tuning in and if you're watching this live or if you're watching it later on the replay. Thanks so much. So just give me 1 second to get my bearings here. So, because here's the thing, I've met so many moms over the years who feel really bad or guilty, and they think or they've been told that their baby, their toddler's cavities were caused by breastfeeding. And that's a terrible thing to hear, right? I mean, I know from personal experience that establishing a successful breastfeeding relationship can be really, really challenging. Literally, sometimes it takes blood, sweat, and tears to establish that successful relationship. And so the last thing you want to hear then at some point is that this somehow, inadvertently created this problem. That's terrible news. And so I've met so many moms, and sometimes they're in tears and, what to do at that point. Like once it's a little bit too late, like there's damage on the teeth. Maybe it was caused from breastfeeding, maybe it wasn't, maybe that was part of it. But at any rate, it's not a good position to be in. And then on the other hand, I've also met plenty of moms who are completely unaware that there can be a relationship and that it could be a problem. And then, they're happy to find out, hopefully, in time before there's a problem that, hey, let's make sure that we watch out for a couple of specific things and take appropriate, precautionary measures to have all the benefits of the breastfeeding and none of the potential pitfalls. So I'd like to actually start with the very basic mechanism of how cavities form in general. I think that's an important piece of background info that is really relevant. So essentially, every single cavity, no matter how you slice it, begins when certain types of bacteria that we all have inside our mouths produce acid. And so even a baby, pretty soon after they're born, they begin to harbor these bacteria inside their mouth. And for the most part, these bacteria are not necessarily harmful unless they are left on the teeth for an extended period of time. So why do we say brush your teeth, twice a day? The bacteria are normal. They're part of the typical environment of our mouths. Not all bacteria are harmful anyways, but the ones that produce acid, we just want to make sure that we're brushing them off and cleaning them out of our mouth regularly. So twice a day is good. And when we do that, we're able to reduce the risk of cavities because the fewer bacteria that are in the mouth, the less acid can be produced. And it's really the acid that damages the teeth and creates, soft spots that then form into actual holes, which are cavities. So that is the underlying mechanism of how this all works. How does breastfeeding fit into this whole picture? Like, why are we even talking about that? Okay, So what do those bacteria need in order to produce acid? They need a source of sugar or carbohydrates, right? And if you're hearing sugar and you think table sugar or candy, that's just one form, right? So we can find natural sugars in fruits in the form of fructose. There is lactose or milk sugar in dairy products. There's quite a bit of lactose actually in breast milk, which is why it tastes so good. So I think we can be honest here for a moment and say we've all tasted our own breast milk. I mean, it's very sweet, right? And so there's plenty of sugar, natural sugar in breast milk. It's complete nutrition, right? Which is why it's so amazing, which is why it's liquid gold, it's so precious. But so those bacteria that I was talking about a minute ago, they love breast milk too. So the key is you can very successfully nurse your baby and your toddler as long as you are in control of the amount of bacteria that are left on their teeth. So if you're very diligent about keeping their mouth clean, keeping their teeth clean, you're not going to have any problems with the breastfeeding for however long you wish to do it. It's just if the bacteria are there and each time that those carbs enter the mouth, and especially when it is in liquid form and it tends to kind of pool and sit on top of those upper front 4 teeth in particular, that you might run into trouble. So that's a really important thing to know. And then the other thing is maybe after, so if you have a young child that you're nursing, one thing you want to be in the habit of is lift their lip, just gently hold it up, kind of like that, and inspect the teeth and just make sure that they look kind of glistening to you, like white and shiny basically. If they don't, if they look a little bit chalky or you see some little specks or spots, which could be either white or brownish, you might want to have a professional take a look. Ideally that professional is a pediatric dentist, because that's kind of one of the things that we do and that we have a lot of expertise in, to recognize if something is an early sign of tooth decay or cavities, or maybe it's a developmental defect or what have you. But just take a look at your kids' teeth and just be familiar with what they look like. And on that note, I should also say, I mean, they might not love when you do that, but please do it anyway, and please brush their teeth even if they give you a hard time. It's totally worth it. Try to put it under the same umbrella as how you would change their soiled diaper, even if they don't like that. So don't let cooperation be a factor in this. They're gonna love you anyways, and you're doing a good thing for them. So even if they're fussing a lot or crying or being hysterical, please keep those teeth clean, and we're happy to show you how and give you tips and tricks. We actually, for our young patients, the babies and young toddlers, have a special baby room, and that's where we do those visits, and we do what we call knee to knee. So the little one is in our lap and in your lap combined, and then we show you everything. So if you're interested in that, you can go to our website and even take a look at the baby room and figure out how to schedule a visit. But that's not the point of this video. But so what is the other thing? Okay, so what is the other thing that makes breastfeeding really special? At some point it becomes more than just the nutrition, right? Like pretty much once your child starts solids, let's say around 6 months of age, obviously the breastfeeding is still probably the primary means of their nutrition, but over time, especially any kind of nighttime feedings, they're really not about the calories anymore or the nutrients. At that point, it's also become somewhat of a habit. It's a comforting thing. At times, you're really just their human pacifier, right? So especially if your baby is co-sleeping, as soon as they, stir or get cranky and and you offer your breast, like it's all good again, right? So it also becomes a form of soothing. And that's where you also want to just be mindful and cautious that even though, breast milk is overall like fantastic and wonderful. So if those types of episodes happen frequently, a couple of times or more a night, I mean, those are each repeated exposures of the teeth and the bacteria on the teeth to carbs. So just be careful about that. Try to not get into the habit of, offering breast milk, sort of like ad lib, as it's called, 24/7 around the clock, because even a clean mouth just cannot really handle all that repeated carb exposure. So frequency really matters. And in general too, like if you have a slightly older child, let's say it's a toddler, try to avoid the snacking for comfort and those things, because that's another thing that makes anybody more high risk for cavities. And I think that's all I can think of at this point. I'm going to actually put all this into sort of a blog post format also, so you can refer back to it later if you like, and I might add a few more things that I may have forgotten to mention in the video. But I'd love to hear some feedback. Let me know what other topics you'd like to hear about. Let me know if you have follow-up questions, and I'll be happy to engage. Just you can put it in the comments, and I will do another Tooth Talk Thursday video next week. I hope everyone is doing well. Take care of yourselves. See ya.